Bon après-midi tout le monde. Good afternoon, everyone. Just running around today. Just wanted to give you a bit of an update. So in terms of the Canadian numbers, they're still going up steadily. Let's focus in on Ontario and then our local numbers. We're at 62,908 cases. It's a 712 case increase day to day, with Ottawa Public Health at 108. Durham 27, Peel 135, Toronto 213, York 62, Halton 46, and East Ontario Health Unit 18. Donc, les chiffres en Canada, on continue à avoir une croissance des cas, une augmentation des cas. En Ontario, on est rendu à 62 908 cas. Donc, ceci est une augmentation de 712 cas depuis le jour précédent. On est stable dans les 700 régions. We're stabilized at around 700, 720. About a week now. Les cas sont distribués à Ottawa, 108 cas, Peel 135, Toronto 213, York 62. On a Halton 46 et bien sûr, nous, on a eu 18 cas d'ajoutés hier. So I just want to focus in on our numbers, really. I'm going to give you sort of a lowdown on where we are. Donc, here we are. So we've added 8 cases from yesterday, and most of them were I think 6 were in Prescott Russell and 2 in SDNG, and we've now have 5 hospitalized patients, including 1 in the ICU. And we have 5 outbreaks right now, and I will talk a bit about that later. Donc, on est rendu à 134 cas actifs avec 409 cas qui représentent 8 cas ajoutés depuis hier. Avant ça, c'était 18 cas. Donc, on a 5 patients hospitalisés, donc 1 est en soins intensifs. On est rendu à 5 flambées dans les institutions. So I just want to break down the outbreaks. One of them is the one we know as Saint-Jacques, and that should be finishing very shortly. We have an active one at Residence Prescott Russell, where to date we have almost all tests have come back, and we have to date 27 residents and 8 staff positive. We have an ongoing one in the Palace in Alexandria. That's a retirement home where to date we have 8 residents and 1 staff. And then we have 2 other ones that we added, and I want to qualify these. One is in St. Joseph Villa, the other one is Sandfield Place, and both of them were individuals that were taken to hospital for other reasons and happened to test positive for COVID upon hospitalization. So we are counting that as an outbreak because they were positive, but they were not in hospital for COVID reasons. So I just wanted to clarify that, but we are still going to do our usual procedure with those homes as well. Donc, au niveau des flambées que nous avons 5 actuellement au niveau des institutions. Une, donc, c'est à Saint-Jacques-en-Brun qui est presque fini. On s'achève dans quelques jours. On attend le résultat. On a une actuellement à Résidence Prescott Russell où on a 27 cas positifs chez les résidents et 8 au niveau des employés. On a toujours une flambée à le Palace à Alexandria avec 8 résidents qui sont positifs avec 1 employé. Et nous avons 2 nouveaux que nous avons ajoutés aujourd'hui, mais sont un peu différents. Il s'agit d'une Villa Saint-Joseph à Cornwall et l'autre à Sandfield Place à Cornwall aussi. Les 2, c'est comme les mêmes circonstances. C'est des résidents qui étaient là, qui étaient transférés à l'hôpital pour d'autres raisons, mais ils ont, au dépistage routine qu'on fait à l'hôpital, les tests étaient positifs pour les 2 pour COVID. Donc, ça compte comme un cas de ces institutions. Donc, par précaution, nous avons nommé les 2 comme en étant en flambée et nous allons procéder avec toutes les procédures. So that's where our numbers are. I just wanted to sort of go over some of the other ones and just point out some of the acute increases that we've been getting. I mean, you can see we've added 100 in October, but that includes, like I said, 35 or 47 patients, 47 residents and staff from the combined facilities that I talked about. But it's still a big increase, and we're now getting, in terms of the numbers, we're getting up there. I'm looking at our numbers, our case numbers per 100,000, and we're getting up into the high transmission zone at this point in time, and we are seriously considering and speaking with the ministry and speaking with some of our partners as to what the next steps would be, which may be us going back to stage 2 as well, and this is something we're in discussions with at this point. If you look at, again, sort of our case summaries, we've gone up, so our whole area has sort of popped up right now to 409. Donc, au niveau des cas dans notre région, importante à voir, en effet, le sommaire, vous voyez vraiment une grosse augmentation. Si on voit des cas confirmés par semaine et mensuel, vous voyez que on a mi-octobre, on a presque le même numéro qu'on a en 108. Bien sûr, dans les 100, ça compte à peu près une quarantaine qui vient des maisons de longue durée, des maisons de retraite qui sont en flambée. Par contre, c'est un chiffre important. Et au niveau des cas de croissance des cas par 100 000 personnes, on voit maintenant une augmentation importante vers la zone qu'on dit, la transmission est haute dans notre région et on est en train d'en discuter, de voir quoi seront nos prochaines étapes à ce moment. Donc, il s'agit de voir qu'est-ce qu'on va faire la fin de semaine, mais encore, c'est une préoccupation que j'ai parce qu'on voit une croissance importante. So again, I just wanted to sort of to bring that out there and say that yes, we have noticed this. We have been talking about this. We know that again, we're getting it in the community, clusters, families, those type of things, and we also know that some of the numbers that are out there in terms of where at what point further restrictions may play a role, and there are some new numbers that are out there in terms of some guidance documents, and now we're sort of headed to the direction where we're in a high sort of transmission period, and we are seriously contemplating what the next steps would be. At this point, I would just say we will continue doing what we're doing in terms of limiting our visits, limiting our trips outside of our region unnecessarily, sticking with your bubble at home, which is only your household. Donc, pour le moment, entre-temps, nous allons voir comment on va procéder les prochains quelques jours. Mais entre-temps, il s'agit de même conseil de rester chez vous, d'avoir pas d'autres personnes que votre foyer, que les personnes qui demeurent avec vous. Donc, rester avec ça, respecter ce type de précautions. In terms of schools, again, we're at the same numbers. I think we added one school the other day. But no more outbreaks. Donc, au niveau d'école, nous avons ajouté une école, je pense, depuis mon dernier rapport, mais on n'a pas des flambées dans les écoles. In terms of our numbers and our testing, I'm going to give you that as well. We're now up to 64,442 tests done in our assessment centers, and it breakdowns as follows: Hawkesbury 9,897, Cornwall 14,788, Winchester 10,804, Castleman now at Limoges 21,376, Rockland 6,204, Alexandria 1,373, Prescott Russell 185 EMS, and SDNG EMS 334. Donc, au niveau des tests, on est rendu à 64 442 tests de fait dans nos centres de dépistage. Hawkesbury, jusqu'à date, on a 9 897. Cornwall, 14 788. Winchester, 10 804. Castleman, 21 376. Rockland, 6204, Alexandria, 1373, Prescott Russell, 128, les paramédics, et les paramédics de SDNJ, 334. So this is where we are. We are at a time where we have to reevaluate our situation. We are working with our long-term care facility partners to ensure that they have the help that's needed. Our hospitals are helping as much as they can. So I'm going to now answer some of the questions that I've gotten here. There's Your TV, Gabriel asked about some clarifications in North Glengarry. We fixed that. It was just a matter of putting him, our staff inadvertently put him into the wrong areas. So the case numbers are accurate today for both North and South Dundas, as we corrected. James asked me, have the origins of COVID outbreaks at Prescott Russell residents in Hawkesbury been found yet through contact tracing? No, not at this point. We still haven't found where those have come, James. Les droits, confirmer le nombre de... OK, j'ai confirmé le numéro. Est-ce qu'au niveau de Halloween, I will be issuing a press release. That's a good question. Je vais le faire en français aussi. Question about Halloween. We will be issuing a press release shortly, basically discouraging trick-or-treating, given our numbers, encouraging virtual, asking municipalities not to hold big gatherings and events, and offering perhaps some tips on how to have a safe Halloween as well, but other tips of how to have a virtual Halloween. Donc, au niveau de Halloween, nous allons avoir une annonce très bientôt qui va être partagée avec les médias. En effet, nous décourageons d'aller chercher les bonbons, mais de rester chez vous avec des alternatives virtuelles. On demande les municipalités de ne pas faire des rassemblements, des événements qu'on fait d'habitude cette année, et aussi on va donner d'autres trucs au niveau des comment pour avoir une secure Halloween cette année. It's not going to be the same Halloween as usual, I can tell you that. Question about hospitals and Canadian Red Cross. Canadian Red Cross, we don't know yet about what the status of that is, but we are working with the hospitals to help that. And we're also working with Ontario Health to look at other areas of help. Perhaps paramedics can go in if required to support our long-term care facilities and retirement homes. Given the lower number, the question here is, given the lower number of tests being completed, what's the average wait time to book a COVID-19 test at one assessment center? It's actually pretty good right now. It's a day, not more than that. So the numbers have gone down. So I think the waiting time for tests is much better. And I'm also told that they've caught up significantly with the lab backup, and we're now getting quicker results, which is great news as well. Radio-Canada, Jérôme demande des arénas, j'aimerais... OK. Au niveau des arénas, dans les zones rouges, et en effet, je veux juste ajouter qu'aujourd'hui, York à Toronto était ajouté comme une zone rouge dans laquelle on retourne à stade 2. So I want to say that today the government announced that York, which is part of the GTA, is now into modified stage 2, just like Ottawa, Peel, and Toronto. The question arises here about the arenas, and I answered it in English last time. I'll answer it in French now. Donc, les restrictions aux arénas sont qu'on joue peu des parties, on ne peut pas avoir des parties juste pratiques, 10 personnes maximum sur la glace, incluant les instructeurs, les gérants, coaches, etc., pas de spectateurs. Donc, ça, c'est un changement. Donc, on a beaucoup de gens d'Ottawa qui voudront louer nos locaux. Je le décourage. On a appelé nos partenaires municipaux, en effet, de dire de ne pas accepter les personnes hors de notre région à cause de risques de COVID. I just want to also say that because of the issues, because of all hockey has been suspended, really, all games, all indoor activities have been suspended, including hockey. We've been seeing an increased number of people trying to come here and play hockey, and we're discouraging that, and a lot of the municipal partners are are complying and not allowing individuals. And we have told people that you cannot travel, you shouldn't be traveling from one hot zone to a non-hot zone. You shouldn't be doing that. So I thank the municipalities for their comprehension when it comes to that. So that's it for me. I will now open it up to questions. Les questions.
Thank you, Dr. Paul. Merci. Notre première question vient de Rosalie Saint-Clair, Radio-Canada. C'est à vous?
Oui, bonjour. Ma question est la suivante. Pour la période du temps des fêtes qui approche, est-ce que c'est envisageable pour les familles, les groupes d'amis ou encore là, les bureaux d'organiser des grands rassemblements chez eux ou encore dans des restaurants ou dans des hôtels?
Pour le moment, étant donné nos épidémiologies locales, récentes, actuelles, je dirais non. Il s'agit de voir comment on va être dans 2 mois, mais pour le moment, on le décourage jusqu'à nouvel ordre en voyant la façon que le vague va diminuer. Est-ce que ça va augmenter ou ça va diminuer? Et surtout, dans notre région, quand je dis tantôt, on est inquiété parce qu'on voit une augmentation importante des cas. Espérons que d'ici 4 à 6 semaines, on verra une différence et peut-être on pourra avoir un peu plus on peut relaxer un peu, mais pour le moment, j'envisage que si on est comme ça là, non.
Puis, ce serait quoi les prochaines étapes si les cas continuent d'augmenter dans l'Est ontarien?
En effet, nous allons être remis au stade 2, comme Toronto, Ottawa et Peel et York aujourd'hui. En effet, ça va être une décision provinciale en consultation avec nous, avec nos partenaires municipaux. Et en effet, ça va dire la fermeture pas des fermetures de restaurants, mais on ne pourra pas manger dans les restaurants. C'est juste sur les patios, les restrictions au niveau des arénas, les fermetures de gymnases aussi.
Merci beaucoup.
Thank you, Dr. Paul. Our next question comes from Bill Kingston, Cornwall Newswatch. Please go ahead.
Hi, Dr. Paul.
Hey, Bill.
Hi there. I wanted to ask you, you said you're having serious contemplating to a modified stage 2 for our region. Can you explain a little bit about, from your numbers that I saw there, roughly 50% of the cases this month have been in the long-term care home setting. So how do you justify a modified stage 2 that would clamp down on restaurants, I assume restaurants and bars and gyms and that matter, if that's not where you're seeing the problem?
Because over the last cases that I saw, over the last 200 cases, only 47 were due to those long-term care facilities. The rest were in the community and so on. And looking at our positivity rates and looking at the other ones in the ministry, and I know that the government is looking at us, and we're ranked pretty high in terms of number of cases, and also looking at the number of increases. So what the magic number is, and I'll tell you, right now we're looking at, if you're below 5, and again, even if you exclude the latest cases in the long-term care facilities, but between yesterday and today, we added 26 cases, and there were only a couple in the long-term residences. So most of them were made up of none. That's why I'm a bit more worried. I would have been more, not reassured, but I would agree more with you in that, I would get your point, right? So what we're looking at is if you have rates of weekly case growths of like 5 per 100,000 or less, you're considered low transmission. And I'm going to show that next week. I've got sort of the data for that. And if you have between 5 and 25, okay, you're considered moderate, okay. And we're moderate. We're moderate. And with moderate, there is very little benefit to adding further restrictions. However, if we look at our numbers today, we're at actually 42. Okay. And that includes those long-term care facilities. So I want to see over the next couple of days where we are. If we're consistently in the 25 and above range, then there is value to actually doing more closures of those high-risk places. And that's why we're going to take it. So today I had a discussion with the Chief Medical Officer of Health, Associate Chief Medical Officer of Health of Ontario, the 2 wardens and the mayor, explaining that to them, that we would be looking at those. And then trying to extrapolate with and without those. My feeling is that even if I take away those 47 whatever cases there were in the long-term care, that our numbers would still be up above that 25 zone, which will then spark the government to actually impose it on us as well. So, and so in consultation with us. So that's where we're kind of really teetering there right now. And I'd like to see that. My other option would have been to do a Section 22 myself. But again, I want to make sure that we do it in the right direction. And it's easier to enforce if it's done as part of the regulation provincially.
Okay. And my follow-up is the ICU case. Is that one of the Cornwall cases? And is that person, like we've seen in the past, have they been transferred to an ICU in Ottawa?
It's a Cornwall case, and I'm not even sure if it's one of those that's unrelated to COVID. I have to confirm. I just got that this afternoon.
Okay, I'm not sure I understand.
So I remember I said there were 2 cases that were transferred to hospital that had nothing to do with COVID. They just were positive of COVID. So I'm not sure if they're in the ICU for other reasons and just happen to be COVID positive. That's what I'm trying to say.
Okay.
I'll confirm that. I asked my staff, but I didn't have a chance to check the answer.
Okay, thank you.
Okay, no problem.
Our next question, Dr. Paul, comes from Nation Valley News. Please go ahead.
Hi, doctor. Sorry about that.
No problem.
I was wondering, last time we had an outbreak of this size in long-term care facilities, the deaths started to happen by this point, unfortunately. How are the folks doing now in the homes and the retirement homes that have it at this point? Are they doing better than last time?
For the Prescott Russell one, so far I haven't heard anything. I'm not, and I haven't heard much from any confirmation of anything else in the other homes. But so far, things seem to be stable. I too fear a high mortality rate among this population, but let's cross our fingers.
Have you, I guess the medical profession, you might say, they've learned from the last number of months on how to treat these people, and are they showing symptoms?
A lot of them did show symptoms. I don't know the breakdown, but there were, I have in my previous notes, I could tell you that I would say probably 50% showed symptoms, and another probably 25 developed symptoms after we tested them.
Okay, thanks.
Okay, but none had to be transferred at this point, particularly from the one I was worried about was the Prescott Russell because there were so many.
Right. Thank you.
Okay.
Our next question, Dr. Paul, comes from James Morgan, The Review. Please go ahead.
Good afternoon, Doctor.
Hi, James.
My question is, this morning, the United Counties of Prescott and Russell sent out a news release stating that there were 4 resolved cases at Prescott and Russell residents. I was just wondering if you had any idea of how those cases became resolved when it's only been a week since the first positive one was announced.
I don't know. I can tell you that the resolution is 10 days. I can tell you that we are the ones that count the resolved ones. I don't know which ones are resolved from there. We had an outbreak there. If I look at, I don't know if I look at my, if I go to my website, I'm just going to go to my website right now and just check in a second. Because we have, I want to know when the outbreak started, because initially we put them down as a respiratory outbreak, James.
Oh, that's right. Yes, yes.
So I'm pretty sure that if you count the days, 10 is probably the 10th day. And then we got the results a couple of days later, if you recall.
Okay, because it started as the respiratory outbreak.
Yeah. I'm pretty sure that's that. From memory, I'm not sure exactly when they started, but if we go on our website, we can see what date it started. And we started it as a respiratory, if you recall, and then we got the results a couple of days later. So that was a week. So a week ago, we got the results. That was 7 days. So it's conceivable that they were sick 3 days earlier. Already. And now the resolution is 10 days. Okay. We consider you resolved 10 days.
Right.
After, okay? So I think that's how it explains it.
That makes sense. Okay, thank you.
You're welcome.
Our next question, Dr. Paul, comes from Your TV Cornwall. They ask, are those 2 individuals that went to hospital for other reasons part of the 5 in hospital? Are yes. The 3 new hospitalized at Cornwall yes. Hospital or elsewhere?
The 2 are the 2 new ones are in Cornwall. two new ones from the homes, yes.
Thank you. Moving to the phone lines, do those joining by phone have questions? Ceux qui se joignent par téléphone ont-ils des questions?
Stéphane Bourgeois, Le Régional Hawkesbury. I was wondering if you were keeping track of mass testing in the Prescott Russell residence, if we're still showing results from the 9th of October, if we had new cases, or if we have results pending from this week.
My understanding is that most of the cases, the results have come back, and if any, there's just a few. At this point, what we can confirm is that we have 27 positive residents and 8 positive staff.
Yes, and we're not. My second question would have to be related to our general population. It came to my attention today that some of the workers might be living in homes that are not collective homes, but quand si un travailleur travaille dans une institution et demeure dans un semi-détaché ou un logement collectif, est-ce que les propriétaires de ces endroits-là ou de ces adresses-là savent que les travailleurs peuvent être malades ou en quarantaine ou à risque de contracter le COVID?
Je ne suis pas sûr pour répondre. Ça, il s'agit de la place de le partager. Je ne peux pas répondre.
OK. Est-ce que vous suivez ce genre de cas-là, le contact tracing, comme on dit?
Oui, oui. En effet, disons que quelqu'un demeure avec 12 autres personnes, c'est sûr et certain qu'on va faire du contact tracing. C'est sûr et certain qu'on va les contacter nous-mêmes pour dire, oui, vous êtes en contact, vous demeurez avec cette personne-là, quand est-ce que vous allez, faites-vous tester ou faites-vous isoler, c'est sûr et certain qu'on va faire ça.
Si je suis, par exemple, si moi je suis travailleur de la santé, puis je reste dans un logement et que j'ai des voisins de palier, j'ai des voisins dans à une même porte, mais dans différentes adresses, est-ce que mes voisins vont savoir que je peux être à risque de contracter le COVID, ou est-ce qu'ils vont être surveillés? Ou...
Non, ça, je n'ai pas le droit à aller. Si je n'ai pas de raison pour moi, parce que c'est une question de privacy, de privé, si on n'a aucune raison de croire que les gens ont un contact ou devraient être isolés, nous, on ne va pas les contacter. On ne va pas le contacter à moins qu'on ait des raisons.
Okay. And are you planning another mass testing at the Prescott Russell residence?
Yes, we are.
And when would that be scheduled for?
Next week. Well, next week. I don't have the exact date, but we're scheduling for next week.
Thank you. Merci.
Yeah, merci.
Thank you, Dr. Paul. We have one final question from the chat box, if you have the time for it.
Sure. Let's go.
Philip Blanchet, the leader, please go ahead.
Hi, Dr. Paul. Sorry, I was joining late here. The numbers on South Dundas, Jenna said that you had touched on a little bit. Can you get more specific about why the numbers were rejigged for South Dundas?
Because they were put in the North Dundas instead of South Dundas. That's all.
Okay, so it's just
an accident. It was an error.
Okay, and the other question I have about the testing times, is the wait time for results starting to come back down at all?
Yeah, it is. It is. Now it's gone down average 3 to 4 days.
Okay.
And I was told that it should be 48, 72 hours very shortly. They've really caught up on that, Philip.
Okay, because there's 2 people I've talked to who have been tested through the drive-through clinic up at Limoges, and both of them, they were 8 and 9 days for results. They just got their test results very like in the last day or so. So
yeah, but moving forward, what I'm told is that the waiting time is less than that now.
Okay. All right. Thank you.
Okay. But when they did it 8, 9 days ago, that was the peak, if you recall.
Right.
Okay. Thanks.
Thank you.
Any final questions by phone? D'autres questions par téléphone? Seems as though those are all the questions for today, Dr. Paul.
Thank you very much. Bye-bye tout le monde.